Karma sir also. Karma sir is connected, I think.
Karna sir is there. Karna sir is there.
Okay. Okay.
Okay. Okay. Then I'm going to start. Very good morning to all of you. On the behalf of ISPSW and Department of Psychiatry, Kalpana Chawla, Government Medical College, myself, Dr. Prashant Srivastava, I am going to moderate this session, which is going to be held on COVID-19 pandemic, mental health and social practice. As you all know that coronavirus pandemic rapidly sweeps across the world, which includes a degree of fear, degree of worry, concerns in all the spheres of the life. It's a humble request to all of you that please put your mic off. It's easy for the speakers. This is it is disturb all the concerns, all the fears of the person's life.
जो बोल रहे हैं उसमें देगा बोलना चाहते हैं बोलिए Now it is okay, Prashant, go ahead.
Yeah, it's okay. I'm again starting. Very good morning to all of you. On the behalf of ISPSW, Indian Society of Professional Social Work, and Department of Psychiatry, Kalpana Chawla, Government Medical College, KARNAL. Today we are going to discuss on the topic that is a national webinar on the COVID-19 pandemic, which is on mental and social practice. We all know that coronavirus has rapidly sweeps across the world, and it creates the fear, tension, worries among all the peoples around across the world. So now it's a time to reunite, to as a work as a team, like mental health professionals. We are as social workers, they are clinical psychologists, we have many other specific teams are there. So on this we have a three specialist speaker with us, Professor Arun Kumar Pandey sir, Dr. Ashwini Kumar Singh sir, and Dr. Bornali Das. And for the welcome note, I request Dr. Nand Kumar Singh sir to kindly please give the welcome note and welcome all our respected speaker and our participant. So over to the Nand Kumar Singh sir.
Thank you, Prashant. Am I audible?
Yes, sir. You are audible, sir.
So thank you, Prashant, and good morning to you and good morning to everyone. And you have already mentioned about the topic of the seminar, of the webinars. So I welcome all the participants and our three speakers in this webinars on behalf of Indian Society of Professional Social Work and Government Medical College. So in this webinar today, we have three eminent speakers. So first is Dr. Arun Kumar Pandey. Dr. Pandey is the professor and head Department of Psychiatry in Kalpana Chawla Government Medical College and Hospital, KARNAL, Haryana. And our second speaker, Dr. Arun Kumar Singh. He is associate professor, Department of Social Work, Jamia Millia Islamia, New Delhi. And our third speaker, Dr. Bornali Das. Dr. Bornali Das, madam, she is the senior lecturer of Psychiatric Social Work, Department of Psychiatry, Guwahati Medical College and Hospital, Assam. So I request all the participants, please questions, and you have any questions or any queries, please send in the chat box, which it will be very fruitful. So you listen to all the speakers carefully. Thank you. Over to Shyam.
Thank you, sir. Thank you for welcoming our respected speaker and our participant. We have a very great time that our president, Dr. A.N. Verma sir, is with us, and for the presidential address, for the giving the grace of the program, I invite Dr. A.N. Verma sir for giving his valuable suggestions and valuable comments on the national webinar. Over to the Dr. Verma sir.
Hello, well.
Yes, sir, you are audible.
Good morning, everybody participating in today's webinar entitled COVID-19 Pandemic, National Health and Social Work Practice. I'm happy to see that the team led by Dr. Prashant Srivastav initiated and organized this webinar under the banner of ISP Group in collaboration with the Department of Psychiatry, Kalpana Chawla Government Medical College, KARNAL, Haryana. So Dr. Anand has already given the welcome address. Still on this juncture, as a ISP PSW President. So on behalf of the ISPSW, I welcome you all the participants, resource persons belonging to the disciplines of psychiatry and social work, respectively, who will share their knowledge, information and skills to deal with the current crisis situation. I congratulate organizing committee members also to organize this webinar. The theme chosen is very much pertinent in the context of the current global emergent crisis. Really, the mental health professional have to design and adapt the appropriate strategy to combat this new crisis affecting mental health. During the current period of COVID-19 pandemic, the impact of it on various social sectors has already been discussed. And so the mental health issues related to it. Though the theme on today have been discussed at various platforms, the very beauty of today's webinar is to develop insight into the mental health issues of COVID-19 with multidisciplinary approach, a very characteristic of the foundation of social work practice. So for the practice of social work in the perspective of this virus is concerned, I feel primarily we have to focus more on preventive measures on priority basis. And for this, the strategies designed and tailored in accordance with the current crisis for targeted population will be more effective and helpful. People can be communicated through awareness and educational programs by means of media, newspaper, pamphlets, and discussion with the smaller groups to reduce their fear arising out of informed negative news, misleading information, ignorance, false beliefs, misconceptions related to COVID-19. Their negativity has to be replaced with positivity, courage, and confidence. Of course, during this process, safety and precautionary measures like social distancing, wearing masks, etc., are all to be taken care of. The areas going to be covered by the different persons applying multidisciplinary approach to combat the situation will be very appropriate in view of the present scenario, and I hope the outcome of deliberations of this event will be knowledge enriching, very useful, and beneficial for the participants to facilitate to apply the skills and knowledge to deal with the situation effectively and provide professional help to the vulnerable population in particular, and offer knowledge to masses in general. With this, I wish the webinar will be very effective. Thank you.
Thank you so much, sir. Your words is important for us, and with this we will move forward for the relevance of the theme, because if we are not aware about why it is put, why this topic is put for the national webinar. So, what is the relevance here in this current situation, COVID-19 pandemic, mental health and social work? How it is relevant to the current scenario? For this, I invite Dr. Arif Ali sir, who is assistant professor in Tejpur, Assam, in Department of Psychiatry Social Work. He will give the relevance of the topic, why it is important. So over to the Dr. Arif Ali sir.
Thank you, Prashant, for giving me this opportunity. I'm audible, Prashant?
Yes, sir, you are audible, sir.
Okay. So, good morning, ladies and gentlemen. It's my great pleasure to be the part of the webinar organized jointly by ISPSW and Department of Psychiatry KARNAL, KCGMCH, KARNAL, Haryana. As we have already, Dr. Bonos has said many things about today's webinar, but as Prashant has told me to talk about the relevance, why there's a need for social work practice. So as we all know that COVID-19 has caused a universal psychosocial impact, and the consequence of COVID-19 on mental health and well-being at personal and population levels are at manifold. And as we all know that the imposed mass quarantine applied by nation-wide lockdown programs has caused a mass hysteria, anxiety, and distress. And due to the factors like sense of getting concerned and loss of control, this are intensified if families need separation by uncertainty of disease progression, insufficient supply of basic essential, financial losses, and increased perception of risk. So the psychological impact of COVID-19 can be vary from immediate effects like irritability, fears of contracting and spreading infection to family members, anger, confusion, frustration, loneliness, denial, anxiety, depression, insomnia. The list is long. And even at the extreme level of consequence, including the suicide. So due to the fears of COVID-19, 19 has generated an excess of psychiatric manifestation across the different strata of the society. And so when we see the psychosocial impact on various effects like on children, on health professionals, or on the older population or homeless. So like point wise, I would like to discuss why there's a relevance of social practice. So first, I would like to address the need of social work practice in area of healthcare providers and the frontline workers. So as we all know that the healthcare providers and other frontline workers like including bankers, policemen, armed forces, extras are at higher risk, and there is an increased level of stress, fear, anxiety, and anxiety about COVID. And daily we are hearing in the national newspapers and the print and the online media how this COVID-19 is impacting the frontline health workers. And being exposed to COVID-19 cases in hospital, being quarantined, the death or illness of a relative or a friend from COVID-19 had heightened the self-perception of danger by the lethality of the virus, and can all negatively impact the mental well-being of the health worker. So one group to be targeted is the healthcare providers, frontline workers. when we see the effects of different sections of society, first I would like to address on children. As due to COVID-19, the community-based mitigation programs such as closing of school, park, and playground have disturbed the children's usual lifestyle and can potentially promote a distress and confusion. Both young and older children are likely to become more demanding and having to cope up with these changes and may exhibit impatience, annoyance, and hostility, which in turn may cause them suffering from physical and mental woe by overly pressurized parents. So, what group of the children and the stressors? What stresses for the children and adults, adolescents, like stresses such as monotony, then disappointment, lack of face-to-face contact with the classmates, friends, teachers, lack of inner space at home, family, financial losses during lockdown, all can potentially trigger troublesome and prolong adverse mental health consequences in the children. So we have impact on the children due to the COVID-19, and the interaction between the daily routine changes, home confinement, and fear of infection has intensified these undesirable mental reaction, resulting into a vicious cycle. Then when we talk about the other group like the elderly population, uh, as we all know that the notion that older adults and people with serious comorbidities are particularly vulnerable to worse outcome from COVID-19 and create a considerable fear amongst the elderly. And other psychological impact may include anxiety, irritability, excessive fear, feeling of stress or anger. And those older adults with cognitive decline may become much more anxious, agitated, and socially withdrawn, and thus their specific need demand a special attention. When we talk about the marginalized community, especially the migrant population, the daily wages, the slum dwellers, and all. So when we see, according to the psychosocial issues among the migrant during the COVID-19, listed by the internal migrant workers are suffering from a high degree of anxiety and fear due to COVID-19 pandemic, and are in need for psychosocial support. So here, the migration of millions of migrant workers to the native village can prove to be a detrimental for mental health and rural India may be particularly susceptible to suicide in near future due to the heavy economic load of jobless migrant workers. Reports of the migrant workers in the leading newspapers have started appearing in the print media of serious nervous breakdown and depressive psychiatric disorders have already been reflected in various newspapers and print media and the yeah. So here the social workers has to play a major role. The social work fraternity has to play major roles with dealing with the migrant population. So in coming days, definitely governments are doing, but as a social work professional, definitely we have to target this population. Similarly, when we talk about the prisoners are the another important area to be intervened by the social workers. As we all know, prisons are the epicenter for infection disease. Thus, its health should be prioritized in the time of pandemic, and their psychosocial needs, along with all necessary preventive measures, must be addressed with the utmost care. Another important group where the social work has to play a major role is the host population. As we all know that cities in countries like India have large numbers of homeless population and might face unique challenge while fighting against COVID-19. And many of them suffer from chronic mental illnesses, substance abuse, difficulties in assessing the affordable health and higher mobility, which might become exhibited in the critical period of COVID-19. So, thus, the protection of right of this underprivileged section of society, providing them a proper shelter, healthcare should be addressed by the social work professionals. As we are working on mental health, we definitely here also the social work has to play an important role. How it affects COVID-19 effects on people with a pre-existing psychiatric illness is also an important area where social worker has to deal. So as we all know that mentally challenged patients, persons with mental illness are substantially more prone to develop infection disease and are considerable risks of experiencing more negative physical as well as psychological outcome during potential factor of epidemics like COVID-19. So with COVID, with cognitive decline, poor awareness regarding illness, impaired risk perception, reduced concern about personal hygiene can increase the chances of acquiring an infection in this individual. Additionally, the social discrimination, stigma regarding mental illness makes the management of the patient with COVID-19 more challenging when psychological morbidities coexist. And people with mental illness are also regarding comfort and abruptly discontinue the therapeutic counseling schedule and post studies on the essence of prescribing such medicines. Therefore, in this institution, the patients are facing lots of issues for this situation. So, and especially the children with underlying psychiatric illness face more challenges in the support network. So, the social work professional have to take lead, lead addressing social COVID-19. As we all know, social workers are essential in support all those who are attending the webinar will be will keep this how to deal with the this speaker will speak and they will try their all level best. So I request all the participants to listen attentively and all the best to all the speakers. Thank you, Prashant.
Thank you so much, sir, for giving us such a nice overview about the whole the topic. And you have mostly covered the thing why it's relevant for the present scenario and how it is connected with the social work and mental health, and how it is linked to the multidisciplinary team approach. For this, we can move forward with our eminent speakers, Dr. Arun Kumar Pandey sir. Professor Arun Kumar Pandey sir is currently working as the professor and head of Department of Psychiatry, Kalpana Chawla Government Medical College. And before giving the introduction, I will tell that today's webinar, which is going to be held, it's all because of the sir. When I came to that idea with the sir, and sir is very cooperative, and he has given the permission that okay, this is very good for the present scenario, you can do it. So I'm very thankful to Professor Pandey sir. And Professor Pandey sir is having his academic qualification as MBBS, MD Psychiatry, and he has done a postgraduate diploma in guidance and counseling, as well as MBA in hospital and health management. Dr. Pandey sir has previously worked in the Department of Psychiatry, BPS Government Medical College, Khanpur Kalan, Sonipat, Haryana. Uh, at that time, he was also the in charge of the addiction center, and under her sir guidance, the center was awarded as the best de-addiction center in the Haryana, and he received the cash prize of 50,000 from the government of Haryana for that. Sir has area of interest in the social and general psychiatry. He has more than 25 research papers in his credit, and he has presented lots of papers and research articles in various presentations and conferences. So Dr. Pandey sir is going to present on the topic today on the topic on COVID-19 pandemic, how in a mental health perspective. So over to the Dr. Pandey sir. Sir, please.
And I am really thankful to you for your kind words, and I welcome all the participants in this webinar. Now, first of all, I would like to thank my predecessor who have made my task somewhat easier by providing some insight into the topic. Now, because the topic, according to my understanding, should have been and has been divided in the form is a few of the talk about the mental health part, and the others will talk about the psychosocial functioning and how it can be done in a better way, or the persons who are being affected by this pandemic, they may get benefited. Now, first of all, whenever any situation arises, the scenario or the way by which the people start reacting to it, that is very important. For example, multiple of illnesses are there. For example, we can say that malaria is there, dengue is there, AIDS is there, hydrophobia is there. Multi so much. So going into that, if I say that the way by which everything was presented in the form that the media, when it was showing that when initially the COVID-19, this coronavirus affected part, first affected the Wuhan in China, the video, the news coverage which we were getting was this, that people were so scared, and the Chinese government handled it with iron fist, and we were shown that yes, everybody is in mask, everybody was and then what happened, the treatment was being provided. It is known to everybody, but everybody is scared that something very typical, very dangerous has come and is affected as a human kind. As the previous told, that some of the illnesses has got high mortality, very high mortality rates, and some of the close to 100%. For example, hydrophobia, which is by the dog bite, mad dog bite. But we are not that much concerned about that. But everybody is so much concerned about the COVID that we are finding everywhere in every audio, visual, newspaper, video, everything is there, which is making the people more scary and more in a pathetic condition. My predecessor also told that yes, what are the reasons that this pandemic has taken such a magnified view in the mind of the people, that everybody seems to be so tense, so worried, and so depressed. So when we talk about mental health, what exactly we understand it by it? If I can talk about the better mental health, then definitely it will be the amalgamation of the emotional, psychosocial, and psychological well-being. So whenever we are being taxed or because of any situation, it may be illness, it may be financial condition, it may be other condition, that we become somewhat in a way think that possibly our future or the current scenario seems to be quite not in a good thing, and it has got a gloomy picture. Also, the situation. Yes.
Sir, sorry for interruption. Can I
Yeah.
present your slides also? Whenever it is.
Yeah. You can put it there.
Okay, sir.
Thank you. So, continuing that. So, what particular about this? Here we are finding that initially when it was shown, then at that time the mortality was somewhat in the range of 10 to 15% in different countries, especially in the Italy, etc., where the mortality was very much high. Then the financial impact has also been very high for that. It has been come into the newspaper that in India, possibly 40,000 crore rupees every day has been lost out of the GDP because of the lockdown. Now, that is a huge amount. If I compare it with somewhat normal thing, then I will say that the budget of Haryana, that is just around 1 lakh crore rupees. So, in 2.5 days, if we take the total losses of 40,000 crore rupees for the country, then in just 2.5 days, the GDP and the budget of Haryana gets wiped out. So that is the magnanimity of this. Then we have to do the different type of lifestyle changes. We Indians like to mingle a lot. We are not that much oriented towards the physical distancing. The word social distancing I am deliberately not using because that has got a bigger understanding that will also means that possibly we have to be distinct from our near and dear also. That's why I'm using the term physical distancing. So physical distancing, washing the hands very frequently, using the mask, etc., etc. So all these has affected the mentality of everybody. Plus the scenario which is being presented by the audiovisual media, the various channels which says, and as on today, if I can say for the whole world and possibly around 1.62 crore, 62 lakh people are affected. Out of them, the active cases are 56 lakhs, and the death toll is risen to 6.48 lakh. For India, if I can say, then it is 13.85 lakh cases as on today, and out of them, 32,096 people, that is around 2.3% of the total people has died. Now, if I compare that initial part, which I just told, that in the Italy, the initial pictures were that as if around 10 to 15% of the persons who are getting affected are being killed. So that would definitely, it would have been extrapolated to the Indian condition, it would have been a big, big loss. Means 20% of 13, around 14 lakh cases which we today have. Then around 2.8 lakh people would have died in India if I extrapolate that. So all that has created a panic among everybody. Now, my predecessor, the previous was telling that it's especially old people in the children mind already having any kind of ongoing morbidity or illnesses, and on the top of we are that is healthcare worker. We are also too much scared about learning about all this information. When we talk about that, why the psychiatric illnesses are expected to increase during such kind of situation, then we will have to and the prevalence of mental illnesses in the society. For example, it is stated that around 14% of the population, according to the survey, National Mental Health Survey, which was done recently, it was roughly found that around 14% of the population is affected with the psychiatric illnesses. Now that translates into around roughly 18 to 19 crore people. Now, already we have got such a big load in India out of a population of 135 crore in India. If we know that around 18 crore are affected, and if we take even 1% of them to be damn in serious condition, then that also turns out to be around 1 lakh 18 lakh, sorry, 18 lakh. So that is a big thing. Now, on top of that, this pandemic has happened, and which has come with, as I previously said, that various lifestyle changes has been done. The scare of being dead or being suffering from the illness, getting isolated, getting quarantined, and everything. And on the top of that, the financial losses are huge. So, as a healthcare worker, what we can do in such kind of a thing? First thing is this: that whatever the way, whatever the scriptures, whatever the general knowledge, whatever the past information which we have about the general well-being and the general lifestyle, we should re-emphasize that. Like, for example, one of the, मैं हिंदी में बोलूंगा एक लाइन, क्योंकि कबीर दास हिंदी में कह करके गए हैं कि चिंता से चतुराई घटे, दुख से घटे शरीर, पाप से लक्ष्मी घटे, कह गए दास कबीर। तो हम हमेशा ये जानते हैं कि whenever we are in the grip of extreme anxiety and fear, definitely what happens that we tend not to work, we tend not to be at the way at which we should be working. Our resources, our mental strength, that get depreciated, that get affected, that get declined. And along with that, it has been proved convincingly that whenever we are under severe stress, what happens that our immunity also decreases. So it has become double whammy. First, there is a pandemic. Second, out of that information which we are getting, our fear factor, our anxiety, our other related symptoms, they are increasing. That in turn is decreasing our immunity also. So the chances of contracting the illness, even this COVID, it increases. So what happens that with any kind of unstable or decline in the mental strength of ourselves, we are exposing ourselves to different kind of illnesses, including the COVID-19. So what we can do? Every time, whenever a patient comes to any of us, whether it is a doctor, whether it is a nursing staff, or whether it is our very helpful, intelligent, and hardworking psychosocial workers. So what happens that generally we say that, or the common dictum goes, till the God wishes, we are going to be on this earth. जब तक प्रभु की कृपा रहेगी तब तक तो जिएंगे. So we have to re-emphasize that yes, that dictum has not gone away. It is still like that only. So we should believe that yes, whatever our karmas, I'm just speaking from the religious and the spiritual way, right? In the next few sentences. So in that, we have to say to the patient, or to make ourselves also understand that whatever is there in the store, definitely that will unfold. And it is not like that the pandemic like COVID-19 has come for the first time. It has come into the print media, that every 100 years we are getting affected by the pandemic. So it is not like that our generation only has been subjected to such kind of a pandemic. So we need not to lose heart. Second thing is this, that as I just told, that if we become stressful, if we are in stress, anxiety, or in altered state of mood, our immunity is also going to decrease. So what we can do is this, that we have to acknowledge this, because after acknowledging only, we can move ahead, we can think in a particular and a better way. So what is this? That when we understand that we are in a pandemic, and for a longer period of time, already it is 4 months, because the first lockdown happened on, I suppose, 22nd of March. So already 4 months complete. So in 4 months, we have suffered a lot. We have controlled ourselves a lot. We have suffered, many of us have suffered huge financial losses also, because some of the industries in which the people were working, they are virtually closed and shut. For example, I will say the entertainment industry, all the cinema hall are still closed. So whosoever was having the earning from that, definitely it is zero from last 4 months. And it is not sure that till when it is going to continue. So what is there that when we start acknowledging the thing, then we can prepare ourselves for battling it, for overcoming it in a better way. So we have to take care of our health, whether it is physical, whether it is social or the mental. We have to take care of that. Second thing is this, that the period, though the lockdown is gradually getting opened and except of the few part of India, virtually now with restrictions, it is open. So, but still the other restrictions are there. So we have to follow them. For example, using the mask, washing our hands with the soap water for 20 seconds, at least 20 seconds frequently, physical distancing and the other thing. And along with this, the proper sleep and proper diet is very important. As a psychosocial worker, what we have to see is this, that whenever any person or any patient approaches us and shows any of these symptoms, for example, if there is a long-standing anxiety, sadfulness, or fear, or any extreme changes in the mood, for example, high or the low mood, which is on the extreme side, or excessive of worriness or anxiety, or if the person has started remaining aloof, is not interacting, or some kind of eccentric type of behavior is there, social withdrawal is there, or dramatic change in food intake or in sleep is there, we should get alerted that possibly this fellow may be suffering from any kind of mental issues, and in that we can intervene. And if it happens to be somewhat on the milder side, somewhat that can be managed by counseling or the other, we should provide it. But if we find that possibly it is going to be very troublesome, very problematic for the patient, then we can ask for the psychiatric input, that is, the patient can be sent to the psychiatrist or the psychologist so that the further can be done for the patient. A few of the slide I would like to emphasize upon it. Dr. Prashant, will you put this slide number 6, on which table number 2 is written? It is table number 7. Slide number 7. Yes, thank you so much. So because the data is too much, I don't know that how much it is visible, but actually it is saying that this is the data which has been collected from the Singapore and from Singapore, and there it was compared in between the health workers versus the normal population. So in that, what was found that the prevalence part of depression, anxiety, stress, and PTSD. PTSD, as we all know, it is the post-traumatic stress disorder. So for all of 4 of these, depression, anxiety, stress, and PTSD, it was found that despite we, means the healthcare worker, being exposed to the patient, being in the duty to serve them, still majority of them were nearly either the same or lesser than what was there in the non-medical fellows. In the mean and the SD part, etc., everywhere it has been found to be somewhat lower in the healthcare workers. So it means that it is a very good finding in that country, that possibly because we knew, the healthcare worker knew that what exactly is the etiogenesis, pathogenesis, and what exact morbidity and mortality it can create. We are well aware, we are taking a good protection of ourselves. That's why it has affected less. Will you please also put down the next slide? slide number 8.
Yes, sir. Yes.
Yeah. So
This one, sir?
yeah, thank you. This slide is quite visible one, and everybody will be able to find it that in this, the fatality rate by age has been shown, though the data is somewhat 6 month old. It is of February 11. So it is very clear that up to the age group of 60, the mortality or the case fatality rate is quite low. It is up to 50 in the range of 0.2 to 0.4. Means if 500 persons are affected, possibly only one is going to die. And beyond that, when we move 60 plus, then it becomes 3.6. But if for population or the age group more than 80 plus of age, then it is roughly around 15. Means every seventh person affected by it may die or like that. But in India, the good part which has been found, and this is in confirmation with the talk with the various our medicine people, that is they are taking the charge of the seriously ill patient, respiratory medicine fellows. What I have taken into account is this, that see, whatever the population which is coming in the severe form to the hospital, around 50% or 60% of them have already serious comorbidity, and in 20 to 30% it is the old age. But the young people, definitely they have got very less mortality, very less morbidity. So the point which I want to make from here is this, that we need not to worry that much. We have to take all the physical restraints and the other precautions which has been provided by the government of India and the other health agencies. But we need to understand this fact that if we remain mentally strong, if we do not worry too much about this, if we take good sleep and good feeding habits, then definitely I'm very sure, and the literature also robustly says that we will not be in the clutches of the mortality which is being caused by the COVID-19. And in the last, I will summarize like this, that yes, whenever any such kind of stressful condition is there, whenever any such pandemic is there, people will definitely become scared, will become in problem. But with better precautions, with other kind of things which are being provided by the government, we can surely save ourselves as well as our society and country. And in the crux, I will say that the healthcare worker, and especially for the society, the psychiatric social worker, they have got a very eminent role to play in uh, in putting and bursting all the myths which possibly are there with the people, and they have become too scared. Thank you so much.
Thank you so much, sir. Am I audible to all? Am I audible?
Yeah, Dr. Prashant, in last, I will also
Yes.
add one thing. I
Yes,
will
sir.
quote it from the scripture, and in one line, what they say that धर्म क्षेत्रे कुरुक्षेत्रे अर्जुनस्य प्रतिज्ञाद्वय, धर्म क्षेत्रे कुरुक्षेत्रे अर्जुनस्य प्रतिज्ञाद्वय, न दैन्यम न पलायन। यानी भगवान श्री कृष्ण के गीता के बारे में बताने के बाद में अर्जुन ने यह प्रण किया कि इस कुरुक्षेत्र के धर्म क्षेत्र में मैं न दीनता दिखाऊंगा और न पलायन करूंगा, यानी मैं युद्ध करूंगा। सो द whatever the understanding we get from the scripture is also that we have to face the things boldly and in a scientific way, taking all the precaution. Thank you.
Thank you so much, sir. Your encouraging words give a highly motivation to all workers, psychiatric social workers, and mental health professionals who are fighting with this pandemic situation. And Sir has covered very nicely how the COVID-19 pandemic is affecting the mental health and how we have to work, unite, and to work together with to fight with this condition. So, Sir has given also about what are the strategies to implement to enhance our good mental health. So, thank you so much, sir. With After this, I will invite Dr. Ashwini Kumar Singh, sir, who is the. Thank you so much, sir. Uh, I would like to invite Dr. Ashwini Kumar Singh, sir. Sir is the Associate Professor in Department of Social Work, Jamia Millia Islamia from last 2 decades. Uh, Dr. Ashwini sir interest area is the social welfare and public health, disabilities and corporate social responsibility. Sir has been awarded of Doctor of Fellowship, Doctorate Fellowship from Indian Council of Social Sciences. He has contributed in very a huge number of books in a very he has written many articles and research papers in various journals. Under sir, many of the PhD scholars has completed his PhD, and he has guided many of the students in Jamia Millia Islamia. So, sir is going to present a topic on COVID-19 pandemic in a social work practice. How it is related with the social work practice, as we are mental health professional and we are psychiatric social work or social workers. So what to do in this situation, how to work with this condition. So with this, I would like to invite Dr. Ashwini Kumar Singh, sir.
Uh, Thank you, Prashant. It's my pleasure to interact you all. At the outset, I would like to thank you, Dr. Prashant and Dr. Bhupen Singh and their team for inviting me for this national webinar. I think my previous speakers have almost covered most of the things which I wanted to say. That made me my job easier. Especially Pandey sir, I'm impressed sir, your lecture, and maybe personally I got a lot more encouragement because the kind of like phase we all are going through, lot of stress, lot of issues we have been all passing through. This gives me a kind of maybe encouragement. Maybe we can definitely will be able to come out of this situation if we try. Friends, definitely, as previous speaker have already discussed, we are passing through a very unprecedented phase, very complex phase, very uncertain phase, because nobody is sure what is today, what we are, and what we are going to be, what we our future. Everybody is more worried. Everybody is worried about their present day as well as the future also, because it has impacted us in 2 ways. If we take the short term impact, yeah, the immediate impact is about the kind of trauma, the kind of pain, the kind of anxiety, the kind of stress they are facing a lot of relational issues in the family. There's a lot of issues are going. Long term impact is definitely going to impact our mental health issues. It is going to have a serious impact on the psychosocial issues, how we are going to deal with this issue. Uh, I think for social worker, I'll be more focusing on the social work part, because what has happened because of this COVID-19, it has definitely changed the world, changed the scenario, changed the socio-cultural structure, but it has also created more complex in society to the pre-existing problems of social justice, problems of the poverty, problem of the social inequality. All these things have been maybe being worsened because of this COVID impact, because of impact of this COVID-19. Definitely, it has brought more problem, more suffering at the psychological level, at the social level, to all. We can't say that this section of population is less impacted, because everybody is impacted. maybe the well-off people, maybe the poor people, maybe the middle class. Everybody is being impacted. I think we all have witnessed recently the when like Sir was talking about the lockdown, how huge number of people have lost their jobs. There's a huge number of people, migrant workers, have to come back their villages, come back to their rural areas because they have lost their jobs and they have lost their livelihood. This has created huge problems to yesterday reading about the some article which shows like the day according to the NCW the cases of domestic violence has doubled in the during last 3-4 months. The cases of child abuse have been increased in many fold. So there has been lot more surveys and lot more new issues are emerging because a lot of cases of suicide have increased manifold. So I think these are the areas maybe people from the psychiatry and this people from social worker can more dwell upon more study, done more study and all. This is the I think this has created we all are being put on a phase where what to do next, what could be the future, what could be how we are going to deal with. For that, I think for that we need to. I don't know. I will not much talk about the situation because the previous speaker already talked the kind of scenario, the kind of maybe issues complex problems and society. As a social worker, as a social worker, what intervention, what could be the role, what could be the
देना तो अपना फोन
approach that we could adopt. I'll say the intervention. I think if I divide intervention to 3 levels, the first is I think we can call them medical and biological, which mostly the people from medical like the doctors and psychotherapists, physiotherapists. The second level could be the psychological issues. I think people from psychiatry, people from like I'll be more focusing on sociological issues, which is more close to us as a social worker. I think the problem related to the social structure, this more problem of exclusion is going to worsen, and more people are going to face this kind of discrimination in society. Which is we are being having every day we are finding more people are being forced on the marginalized section. People of especially the marginalized section. I think then what could be the role? I think again I'll talk about. I think before going to that about the issues, because when we encountered this problem and then because of this pandemic, COVID-19, and then what two issues have been emerged, which has been brought maybe very serious. One is the health services that we have, depleting health services, health infrastructure that we all know, kind of we have is shown that this was not able to cope up with the this kind of situation. Second was the biggest problem was the lack of comprehensive social security system and social insurance. We can call the insurance where people lost their jobs is a huge number. They are left for nothing. So that was again I think two issues have been emerged, which have been I think if we could have the better health system and we could have the more sound social security system, if we could have more comprehensive social insurance system, we could have been able to cope up this issue more in a more appropriate way. I think different sectors, as I talked about, so different sectors where we need to intervention is, I think, again, I'll divide it into four categories where we need to give our intervention. I think first category will be the provision of basic services. Basic services because you all know a lot of people have lost their livelihood, lot of people have been suddenly have been left for nothing. We have to maybe especially in unorganized sector. Even in organized sector also, people have been lot more problem because of the pay cut has been there, been retrenchment has been there, has been people have been maybe because of we take the example of airlines, take the example of other sectors where there is a complete closure, like where people have to maybe doesn't get does not getting salaries and also that means immediate intervention would be to provide the basic minimum services, which could be the food, shelter, and then other kind of measures. That has been lot of people are working, lot of sector, lot of sections, a lot of sections of society are working. Maybe CBOs, NGOs, and then other sectors are people. Here the role of social worker is again very important to other frontline workers. They can come up and they can collaborate and coordinate with the people who are working, and in themselves they start with arrangement and then distribution and then helping these people to cater their basic needs. Second level is community and family support. I think family level is also what has happened because of because of this kind of lot of people are coming back to the family and the migrant people and then other issues, and even suddenly people are being asked to stay at home. That has maybe has brought new challenges to the family also and the community level also. I think there's also they need to provide certain such kind of reintegration, this kind of some kind of a services at the community level, at the mohalla level, wherever they are working, they need to provide services and then provide the help. Third is basically to non-focused, non-specialized services. I think these are the services with the people who have maybe who have been impacted. Maybe some family who have somebody being infected, or maybe somebody has been impacted. So there they need to provide the information, then all kind of trained, skilled services of psychosocial as well as the counseling services. People who are being infected, or maybe the people who are being infected. Fourth level is people who need specialized services. I think people who need treatment, who need especially has to be like admitted into the hospital, who have to be hospitalized, and then they need a kind of specialized treatment with the help of medical experts and para-professionals. These are there also. I think you all people who are working with the medical social work, people who are working with psychiatric sections, they can be great help to form a comprehensive team of treatment and then maybe for using all behavior therapies, various interventions. These are the areas where we can intervene as a social worker. Now next come to I'll be very brief about the what could be the role. I think the beginning role has been information dissemination. What has been everywhere we find lot of information because this era of social media, then a lot more videos, lot more information is coming every day. But what is actually the correct and which information is actually helpful for me and which is not? That level you need to provide actual information. As previous speaker sir was talking about the like the issues related to social physical distancing, issues related to the washing hands, maybe and other issues related to the basic information. I think a lot more modules are available for people. Maybe Tata Institute of Social Sciences has created modules. AIMS has created. Lots more modules are available for the people who are being infected, maybe who have not the serious impact, maybe severe, able to disseminate information that we get to the people. Otherwise, there's a huge scare in the society. Everybody is maybe stressed. Everybody is depressed. So that means correct information is important, and especially for the vulnerable sections of the people, because they lack information, and because this lack of information they make them more prone to getting this infection and getting to be more problem for this COVID-19. The first and foremost important thing is appropriate information should reach to the people who are being of different section of society. I think next has been facing trying to a kind of where whom to contact. If in case of anybody any symptom or maybe anybody has any issue, whom to contact. There has been lots more cases because every day you find in newspaper and all, and then how to appropriately go, and then in that section also social worker can be helpful and they can provide appropriate referral, appropriate information, and appropriate maybe places they can help them to reach. Third is arrangement of essential services for communities and families. I think I've already discussed. There's a lot more people around you, people in your community, people in different section, different communities are being facing lot of economic issues, lot of issues related to livelihood, lot of issues related to the maybe providing uh, basic services. I think that help needs to put. But one thing I'll definitely kind of say कि what is happening, हम किसी की मदद करने जाते हैं तो वहाँ पे बहुत सारे कैमरे भी लेके जाते हैं, तो please avoid this. If you are helping people, if you are making so make it confidential, maybe as a social worker you need to do it, because what I'm finding lot more pictures on social media, and when social workers are putting, yeah, I have done this, I have done this. Please avoid this, because this is our job. This is not to, we don't want to show anybody. We are being basically ethically, we have to do it, and it's our job. That is arrangement of, and there are a lot more people who are ready to help. Lot more people are there to who can contribute. We need to kind of build a network. We need to bring a kind of system where I think system creation is very important. Where actually the appropriate service should reach to the actual person. Next is, I think, how organize psychological and social support. I think I have already talked to you in case of mental health issues and other issues. I think most of the people in society need nowadays this kind of services because they all are facing one or other way. If you ask me, definitely I'm also facing. Everybody is facing. So that you need to provide some kind of services for them. What has happened? One more thing, which I was thinking about the when we provide the services to people. Two things have been very important. One is we try to follow the universal model provided by WHO and all, but that's not being sometimes not working to our system. I think we need to develop, we need to identify the indigenous models of health, because our indigenous model is so capable enough to deal with the issue. I think recently we have been started focusing on immunity booster and other local practices which are helpful. And if we build confidence among people, and they can even overcome, and they can be how it can be helpful, and then indigenous form of help can be kind of a great help. But one more thing I will add here also, that culturally appropriate services. What is happening, because lot more, if we don't take the confidence people in confidence, like the people whom we are working, because initially you have lot more cases where people are being health professionals being attacked in different areas. When they went for the help, they were attacked because there was a lot more rumors and there was a lot more issues were there. I think you need to take confidence. The local people and the practices should be culturally sensitive. Any community with whom we are going to work or working, we need to take them confidence and do something which is not maybe objectionable to them, and then otherwise there's a lot of these problems can be reduced. This, next is what has been, I think, the this social media I talked about. Social media becomes the important tool for outreach, because we can what is happening in case of online classes and all. I think this is the same way. This social media, if we have the correct information, and then we have appropriate information and reach to the different level of people, different section of people, to the different outreach. So that will be uh, helpful. That's the way I say ki it's a time to find the innovative ways of engagement. We need to find new and new ways of engagement with the people, talk to them, maybe how we can help them. That needs to be done. Networking is very important. Networking with different sectors, networking, and then with coordination with different sections, maybe health professionals, NGOs, CBOs. They all are definitely going to be great help. And then that is coordination and networking is very important for social worker. And then they can use all these skills that what they have to strengthen this system, these systems of health, which could be to reach the maximum people. I think again, last I'll say that there are certain section of people who are being more vulnerable, like the elderly people. I think previous speaker talked about the elderly people, people differently able people, that they need to be extra care, and then I think there needs to be a kind of system created, special system created for them. Last, I think I'll say two things because you can use all your skills and then methods, casework, group work, community work, which are being definitely being taught to you and then taught to all of us. We have been, they can be helpful. But one thing is very important, which is lacking, is I think this is the time to be. This is an urgent time to need build a strong healthcare system and then social security system. These two things definitely, any pandemic, any disaster, these two things definitely is going to be great help. I think we social worker and maybe all health professional or maybe para-professional need to work on it. If we can able to maybe more lobbying or anything, pressurize the government to bring this healthcare system more strong, healthy, strengthening the healthcare system, and providing the especially social security systems, social insurance system. I think that would be more great help to the people, especially the marginalized, especially the vulnerable sections of the society. Okay. Thank you, Prashant.
Thank you so much, sir.
Thank you.
Thank you so much, sir. Sir, there is a one query from Wakar. I mean, he is in the University of Kashmir. He wants to know what can be the social work strategy to address the stigma attached to the COVID positive patient and their families in society. Yes, it is very important, sir, because as we are working in this situation, we understand how it is creating the stigma to the family. So, what are the strategies according to you, sir?
I think strategies definitely maybe any issue what we discussed, dissemination the correct information, because as I was said at the beginning itself, because lot of even if we have something, because lack of information makes it to behave in that way which is not ethically appropriate. If we have correct information, if we have the appropriate understanding of the issue, then definitely because we can overcome this issue. Because there have been lot more issues with the people working with the maybe infected people and people who are working with the health professionals. There's a lot more issues with them. I think correct information dissemination and understanding of the issue will definitely will overcome this stigma and then this kind of maybe discrimination with the people who are working or people who are being infected. Yeah.
Okay, thank you, sir. I think this
I
is
think
very
Pandey sir wants to
important.
say something. Yeah.
Yes. Yes.
will create a good picture in the mind of people, and people will understand that yes, anybody can be affected, whatever the caste, creed, social position of the person. Then definitely everyone will understand that because it can affect anybody, so no need to stigmatize anybody who has suffered or who is suffering from the illness or their family. Thank you.
So much, sir, for giving a valuable lines on for this question. And sir, there is one query for Dr. Ashwini, sir. In the current situation, people become more hopeless, helpless after seeing so many positive cases. And if someone is suffering from any disorder, in that case, they came to hospital, but they are not getting better treatment in hospital due to increase in cases. All are become phobic about today's situation. Sometimes they lost their loved ones. So what can we do in this situation? Ashwini sir, please sir.
Yeah, Prashant, I think I'll take it two-way. This question in two sections. One is, I think definitely, I just talked about the kind of health infrastructure we have. This is not able to cope up with the huge number of cases, and then because we have somewhere lacked the correct planning, and then we invested a lot in different sections. It could have we could have built more hospitals and more specialized hospitals. We could have been able to overcome this issue. So that this is shown the countries who have the better healthcare system, and then because with this problem is also a different section require different kind of intervention. So I think if we could have better health system, that's definitely a challenge for all of us. That's why definitely we need to create more legislation healthcare system. I think the people who are being not getting, then people have lost their loved ones. I think this is crisis situation unprecedented. This is nobody's even thought of or even hoped about. We all need to come together. We all need to strengthen our. We need to psychologically and then anyway we all have to help each other, and then definitely we have to cope up this situation because this situation is unprecedented. This is crisis. It's a huge crisis. I'll give another example. I mean, I have heard people listening. It is a future plan for next whole day. I mean, I'm reading any. I'll not have more kids in the future. Because people are so unsure. People are so. You never know what could be the life after 6 months, what could be the life after 2 years, and nobody is giving the guarantee we will be able to come now. We were 4 months back, फरवरी में जैसा हम जीवन रह रहे थे, क्या ऐसा हमारा लाइफ होगा? Nobody is sure. Nobody is giving the guarantee. I think this is unprecedented. This is a very serious situation where we need to help each other and definitely to build more maybe sound healthcare system. Then that definitely maybe we can overcome this issue. And one more thing, I think awareness creation, because a lot of countries have shown people are being literate, people are aware, they're able to reduce at least nobody the infection rate and all. These are the issues we need to take care. Yeah.
Thank you so much, sir. I think social work practice licensing is very important, as you have mentioned that we have to come together in all the situation to handle this situation where stigma is there, where problem is there. So if we will come together, we will win at that point of time. With this, there is again one query from the Himanshu sir. He wants to ask that as the field work is the essential feature of social work practice, social work curriculum, how it can be managed without due to lockdown, etc. conditions. Sir, your voice is not coming. Yes, sir.
Okay, definitely. Now it's
Yes.
Okay. I think
You're
fieldwork
audible.
is very important. Yeah, fieldwork is very important component and to our curriculum. And we all also facing this issue how to go about it future. We are also thinking and talking about this issue because face to face interventions required, because fieldwork is not only you have to go online. People fieldwork is not only to maybe you can submit the assignment and all. That needs to be a kind of actual intervention and actual going to the field and interacting the people. Then only you can. We are all also thinking about the alternative ways. Maybe we can modify our this face-to-face thing. We can, instead of sending every day, we can have blogs. We are thinking about that. Innovative ways and means could be developed. And last, I'll say definitely fieldwork. Like everybody is going, like healthcare professionals, you all are definitely working with people. I think you all are being in hospitals and maybe you are dealing with the daily people. I think social worker also being a frontline worker, we have to go outside and taking all precautions, because like everybody is doing, because in the new normal people have started working, people have going to the office, going to the hospital, going to the bank. I think in the same way social worker also have to go to their field, will definitely will go with taking all precautions, and maybe with some innovative ways can be developed, some to maybe this field work issue in social work. Okay, thank you.
Thank you so much, sir. We are very enlightened about your thoughts, and we are. I'm very happy that many of our participants has actively participated and given a positive comments about the pattern we are looking in the hospital setup, and these words gives us energy. Uh, Students and parents are much worried about education and career, how to manage their stress. I think sir has discussed about this area. Dr. Sanjeev has asked this question. So, what's your comment about and what you want to say on this situation?
Definitely, sir. We all are worried about our future of our kids' education and all. I think we are working on it definitely to innovative ways and means of being definitely to how do we go about in education and all. I think there are already something unprecedented has emerged, something the crisis has emerged. Definitely, we all are working and we all will definitely will overcome this issue, and then this will definitely will come to maybe new normal, maybe some ways and means definitely will emerge. And we all are together to help maybe to help each other to overcome this issue.
Thank you so much, sir. There is one question for Professor Arun, sir. Uh, Hello, Arun, sir.
Yes, please.
Sir, Dr. Naren Kumar Singh sir, from CIP, he wants to ask, after the recovery of the patient, people and society is neglecting them. So what could be our strategies for them?
Okay. Thank you for the question. The thing is this, whenever any such kind of life-threatening condition will be there, everybody will be here. See, if by being associated with someone or by living with somebody, along with someone, we are going to contract illness. Definitely everybody will be scared. So similar is the situation here. As previously told in between, when we create a good example, or when we inform, for example, I stated in my presentation that in India, currently around 13.85 lakh people have been infected by the COVID-19, and around 32,000 deaths have been there, which amounts to 2.3% of what have been infected. So we can first say that, see, out of a population of 135 crore, only 13.85 lakh people have been officially declared that they have suffered from COVID. And out of that also, only 2.3% have died. So it means that if we take the whole population of 135 crore, it is a minuscule amount, right? The US data, American data also shows that possibly the common cold that is also somewhat slightly near only killing the people. So it is later on, it is going to possibly come the scenario in which everybody will be saying that yes, this COVID-19 was blown out of the proportion, and whatever the information and the scariness which was there in the general public, possibly it should have not been this, but it is my mere wishful speculation. So coming to the current situation, first thing is the information that out of the so big population, hardly 0.01% people have been affected, and the death has been minuscule. Second thing is this, that in between I told that if we give better example, when even the best of the best kept people like the presidents, the chief ministers, the politician, the bigger officials, higher officials, our Amitabh Bachchan and his family, they can get affected by the COVID-19. Everybody can be affected. This can be the best example given to every person in India. क्योंकि अमिताभ बच्चन को हर कोई जानता है, अगर उनका हम उदाहरण देंगे तो हर व्यक्ति इस बात को समझने की कोशिश करेगा. तो information is the most important thing which we have to provide to every people, and if we will be giving good examples from which everybody can understand that yes, this illness can affect anybody. And we can also give the example of AIDS. Initially, when this illness came in 1980s or 90s, about HIV AIDS, everybody was so scared. Everybody was being will touch a patient who is suffering from HIV AIDS. Will also be having this AIDS on. It was this is not the way. Neither it is going to kill you if you take the medication, if you take the precaution. Nothing will be a problem. And now you can see the status of HIV AIDS. Rather, nobody talks about HIV AIDS in the current situation. So similarly, for any illness, if we are going to provide right information, right communication, and that also by the prominent people in the society, and in that I will say that the psychiatric social workers and the social workers have got a very important role. See, what happens that in society, it is generally that other people get the limelight. For example, I will say the administration, or say the doctors, or say the lab technician, or the nursing staff, they tend to take the more limelight. But be assured that whatever the good work we are doing, the psychiatric social workers are doing, the social workers are doing, that is definitely going to be get accounted. And I request to every person who is listening to this webinar that if you are in a position in which you can give a fair amount of exposure to everybody, that yes, these are also the people who are doing a lot of work for the welfare of the society, for the COVID-19 patient, then we are going to give a big impact, give right information and the right initiative in which we will be able to remove this stigma that yes, once a patient or once a person or once a person in a family has been affected, they need to be outcasted. It shouldn't be, it will not be if we provide the right information. And I once again emphasize that in this, the role of social worker is very important because they are in direct connection to the society. If they will be providing the rightful information in an emphasized and in a right manner, everybody will get benefited. Thank you.
Thank you so much, sir. Sir, you have covered the Dalveer Singh point, as he has pointed out that social workers are playing a vital role in COVID-19 pandemic, working an isolation ward and corona positive patient related mental health and psychological well-being of them. But importance of professional social workers is not same like other paramedical staff, like lab technicians and staff nurse in healthcare. But you have given the appropriate answer of this question that yes, social worker have also a potential, and he have he has also they have also capabilities to serve the humanity to get the same situation in this scenario. With this, I think there is no more queries there. So, for the encapsulation of the session, I congratulate to and thanks to both our respected speaker. And for encapsulation of the session, I would like to request Dr. Bornali Das. Dr. Bornali Das is a senior lecturer in Psychiatric Social Department of Psychiatry, Guwahati Medical College and Hospital. She has worked for 20 years in the mental health, and she is involved in many research activities. She is the reviewer of the part of Open Journal of Psychiatry and Right Sciences, and she has contributed a many research paper and presented a various paper in international and national conferences. So with this, I would like to request Dr. Bornali Das for encapsulation of the session, summarizing the session. Dr. Bornali Das, ma'am.
Yes, I can join you. Very good afternoon. From morning it has become.
Yes, you.
So, how much do I have to time? How much time do I have to present or to encapsulate?
Ma'am, you can take 15 to 20 minutes, or it's up to you. We have a time of 30 minutes left, so you have a time 15 to 20
so
minutes.
First of all, I would like to thank each and every speaker, and then I would like to encapsulate their presentation, and then go to mine, which I am working in the medical college, so I would like to contribute practically what we can do. And what we are doing. So, thank you to the mental. This is a very apt topic: mental health and social work practice. Thank you, Prashant, and I would also thank the organizing team, Indian Association of Psychiatric Social Work, as well as Kalpana Chawla Institute. And with this, I would like to allude to that the welcome address as given by Dr. Nand Kumar Singh. He was basically giving an insight to mental health issues in practice, awareness, and through mass media, how we can reach to many people or the masses in a bigger magnanimity. After that, Dr. Arif Ali, he had spoken about the relevance of the theme, in which he had spoken about universal psychosocial impact, which has been manifold, from mass hysteria to uncertainties or the loss of control, internal control, external control, or the locus of control internally as well as externally. He has covered the various aspects of the biopsychosocial model, from a marginalized community to impact of nervous breakdown and job losses, then how the impact is being in the prisons, homeless, mentally ill, disability, children and adolescent, and elderly. So almost each of this topic has been briefed by him in brief, and the potential risk and methodology in managing it has been alluded to you. So the third speaker, he spoke about the third speaker is Professor Arun Pandey. He is the psychiatrist, and he has initially started with normalization technique, means how to normalize the society and the COVID-19 pandemic, because it has come out as a blow to each and every one of us who don't know about it, how to deal it in the very first when it came to India. We have heard it from WHO and from China as it was presented from them. But when it came to India, we had to again grip ourselves, like how to prevent or promote or how to manage the situation altogether. So focus with there was a lot of fear, anxiety, worries which were there. So he spoke basically about the emotional, psychological, and the social well-being that is getting affected. So along with that, he also focused on the importance of responsible media and its coverage. Then Professor Professor Ashwin Kumar Pandey, he also focused on the interrelation of stress and immunity. Like if we are stressful, the immunity would definitely go down, and if we can manage our stress, then definitely we can overcome the illness or overcome the disease in a much better way. Impact of the job scenarios also also was his explained to us very well, and about the mental malaise and the economic crisis and the issues that we have been facing currently. There has been another aspect which he has brought to the light about the study, which has shown that the research implication, this wasn't a study from abroad, but definitely there are a lot of studies which are also going on in India. We have actually published one paper in Ojapas, and others are in process in Asian Journal of Psychiatry, which will come in near future. But however, he has been very importantly given as the mental strength is being emphasized. Active suggestion is required to ourselves at this point of time. And with this, he also has teaches us how we can go ahead with the experiences. Because with any positive or negative, we at least learn experience. And from this experience, we can move ahead, like how to deal with it. So by now, already 4 to 5 months have passed, and so we are being able to deal with it. And somehow India is much better than many other countries of the world. So basically focused mostly on the sociological issues of the social workers. And talking from the social stratification and the marginalized and the stigma discrimination and social security system to be undertaken in the way we need to take forward. And information dissemination was emphasized by being very pertinent to be able to inform that and these should be in the so community participation was also focused by him and the services. And he also said as a frontline worker, work with anonymity as an ethical practice should be followed by social workers instead of documenting each file. If we are putting in documents, then we need to focus on beneficiaries and clients, and then we can take we can go ahead with what if we have to do it for publication or research paper or whatever, or if we want to I feel that is the most important thing, because we have to take out the have a lot of technology which we can create in our own community, because social culture is different from the West. Instead of taking the book, we need to take the methodology. Maybe we can make it into more Indianized version, and from here it needs to go into a global phenomena. If you go through WHO work material or work material from abroad, those also focus on the regional aspects of their areas. So we also need to focus on the localization, and that should go into globalization. So acceptance as a new normal. So we are dealing with this as a new normal, like wearing of mask and social distancing or physical distancing. And with these challenges, we have to move ahead with our work. We cannot shun away from our work than saying that, no, we cannot, give service. But definitely we can give service with all the precautionary measures that if we are taking in a proper way. So he has also spoken about the innovative ways of engagement, and that also brings the punch to his presentation. So with this, I would like to go to mine little bit, which I have prepared. If you have time, and if I can go through. One second, you can. Yeah. You have the presentation. Could you just present? If you can put it forward, it is the same.
Because you can present it with the PPT of ma'am.
After the summary, just bring it back.
Presenting.
Yeah, I have only 2 slides anyway. Can be, right? It can be enlarged. So our profession is actually a 120-year-old profession, and if you see in federal hospital, there's a social system. Impact in the world when there has been massacre or whenever there was disaster, like the World War. They found the essence of it, and Mary Richmond was the person who was documenting along with the doctors at that time. And slowly it had, if you remember from 1917, she had worked on the role of personality and society influencing the mental health of the people. And then slowly, at that time, she was working on like assembling the social data, interpretation of recommendation of treatment, and helping the discharged patient accomplish social and rehabilitation measures for the recovery. And after this years, in 1942, again, the impact became even more stronger with the Second World War. And the Holocaust, it was said the objectives were to centralize the data on the personal vacancies of PSWs and to establish the vital and immediate relationship with the professional education of the PSWs. So the PSW profession or the social work profession is a socio-cultural and a need-based the subject. And so it needs to be more Indianized to globalized, which Professor Ashwin Kumar sir had already mentioned, and I would like to reiterate the fact once again. So the casework, group work, or community outreach programs, this is another important aspect for us as social worker, and we can help them. Can we go to the next slide? That we can help, that we can, work with the people in a micro level, meso level, or in a macro level setting. When I say micro level, it means that 1-on-1 means now since we are at home, or if we are going to hospitals also, we are not supposed to meet very closely to the people. And when we do individual therapy, or when we do psychoeducation, or when we do any kind of family intervention, we have to take the detailed workup for about 1 hour or 1.5 hours sometimes. So in this situation, it becomes very difficult. So what we have done, we have turned everything into phone. So when it comes to phone, we can go into detail. Nowadays, I do by Google Meet and also by Zoom. So that my clients are not being affected because we are sitting down at home or we are working from the hospital. So we are reaching out to them in a micro level from the home setting itself, so that our services goes on. Secondly, we can help in the meso level, or to the friends and the relatives. We empower them. Proxy therapist, we suggest that mother needs to become a proxy therapist, or the other family members who is close to the person. Because in this lockdown scenario, you have seen that anxiety, depression, and all kinds of malaise have increased in this whole regard. So in that case, in meso level perspective, when you encourage people who are along with them, especially, I'll just give you an example which happened last week. A lady, she was working in a school and she was doing online teaching, and she was a teacher. I mean to say, she is a teacher. And along with this, she was dealing with her depression from December onwards. And with her, she has a tendency of committing suicide, and it was coming it in a very, very strong form because of the lockdown scenario and not meeting people. So in that case, her mother was being called, and in our way of communication, in my way of communication, the way I told her, way I narrated the whole thing, she accepted it. All these years, she has not spoken, the patient per se or the client per se has not spoken to the mother. But here, sometimes we have to do the breach of contract when it has to reach to or save the person, so or save the life of a person. So in that case, we generally call up the family members and explain it to them so that they are in a better position to deal up with their own clients in and around. So, and in a macro level or in a community institution level, that we can do by doing webinars, like today is the best example. We are being able to reach. I'm in Guwahati, others are in other places. From Bangalore, I have given the contacts, so some of them have logged in from Bangalore, some of them have logged in from the West. So what has happened that we are able to reach it with our information through this platform, and it has become easier. So we need to take the positives, means we have to act upon the positives also. So this is the new normal, and we have to accept this new normal and go ahead. Next slide, please. Am I audible?
Gus?
Yes, sir.
What we are trying to do, that we are talking about, somebody has spoken about the field work, because now people are sitting at home and only online education. What we have done in Assam, we have floated a Monon. It is a telephone helpline through 104. So what people have done with the people who are into the community, they can reach out to us, and we have this, like, in today's day we have 31,000 counselors. So we have more than 300 plus counselors, clinical psychologists, psychiatrists, as well as psychologists, and day counselors, and public counselors, counseling psychologists. So all these people have come into under one banner. They have been trained, and we are person of three. And my colleagues, two of the colleagues and myself, we have trained them. And what we have done, we are reaching out to the COVID positive people. So in that case, what has happened? When we are reaching out to them, and when we ask them, how are you? We have called you, whether you are well in the hospital. Then they give a very, very positive reply that somebody is there to ask about our mental health. And that's how, this is one way how we can reach out to them and make our work successful, beside being that we are not going to the hospital or we are not going to our respective place where we used to work. Secondly, we also have to know about the laws. Because this we have come to know only after taking phone calls. Many of them have domestic violence problem, others have other crisis problem, or the child labor. Sometimes we get the child with in difficult circumstances. So we have all these issues. So in that case, we also had worked up with the network with the police department. So, and sometimes it has also happened, the migrant laborers who were coming back to Assam, they were not getting the food and the other essential items. They were being ostracized. Their stigma was there. In that case, what we have done, that we have worked up with the police department so well, and also the local media, that police department is helping us to reach out to them by giving the food and even MPW workers. And people have not got medicines. So the MPW workers, Anganwadi workers, ASHA workers, they are already in the field. Through them, we are reaching out to them through NHM and 104. So these are the possible, possibilities that we can explore. For that, we need to know our laws well. So another aspect that as a social worker, I feel that we need to work in all settings, as you know, and we are working in all type of environment, and we have to, work in an organized manner while doing it. And skill building means how we ask the questions. That is very important. Our tonation, our communication. Somebody asked about the stigma question. Then most importantly, when we meet a person with angered, means agitated person contacting us, and if we also, give that kind of tonation, definitely the person will not come to us for the second time. In that case, we have to know that our tone, tempo, volume, how we are addressing it, our communication style, pattern, all these will become very, very important. That is why the skill of knowing the interviewing techniques are important, and also the documentation. Whatever we are doing, we also need to tap information. We need to keep our information intact so that we can do the research work later on in our, after 3 months or 6 months or whenever or interim research reports can come out and show it to the government that this is what we are doing and this is how we are thinking of moving ahead. Now, like for migrants, there are a lot of migrants who have come back. So we have given a report to the government that not only this, we also need to work on the anti-stigma campaign, and we need to reach out to them in a different way by giving them jobs which are more localized in nature. Next slide. Next slide. Yeah. So as practitioners, actually, in this lockdown, we came out with 2 books. So one book I have, it is on mental health and psychosocial support, which is more like a workbook kind, and it is of much benefit for all the kind of psychiatrists, social workers, as well as clinical psychologists, lay counselors, everyone, including voluntary workers. So as practitioners, volunteers, one need to be empathetic. What are the qualities that a person needs? He needs to be empathetic, be respectful, and to understand and resolve the conflicts in a very objective manner. Active suggestion needs to be made at this point of time. And also the multimodal and the multidisciplinary team needs to work at this point of time. That means we need to reach out to not only psychiatrists, psychologists, or psychiatric social workers, but also the administration, district administration. Like after the COVID patient being who dies in, who succumbs to COVID. So these kind of work also are being undertaken in Assam. So as next is that as practitioners, maybe I can answer you if you have questions after this. Maybe we can go to the next slide also. So to take it to a panel, sufficient number of trained volunteers that we have done, and seeking support and also reaching out to them. It is important to know the team are well, otherwise it will become a hurdle. That is why we give webinars and every week we have also decentralized our work. That means initially government work had given to leadership to 3%. We have disseminated to some of the senior people so that they can make the calls and they can reach out to them, and how the work is going on with the COVID positive people, that is undertaken through this. So it is important to know the team well, that is why, and be a team player, transparent with the team, and neither to argue or defend any team member. That should be our motto when we are as a leader, because I understand that many of us here are either college teachers or or those who are already working in the field. So that means we are in some ways leaders. So let us be transparent and let us understand our team well, neither to argue, not to defend any team member, or accept the mistakes as a human error, and the important message that needs to be taken, and go ahead with the work. Next slide. So this is what I had to tell you. Because we are all going through a stressful time, and it is not bad to say that it is, all of us are going through the stressful time, accepting it and also finding out solution for them.
Go ahead.
Hello.
Yes, go ahead.
Hello. You all getting my voice?
Yeah.
Thank you so much, Dr. Bornali, and very sorry for interruption. Might be there is some technical problem. You have very well incorporated all the things, and what the things you have also motivated us for writing the research papers, research articles on the COVID situation, and you have covered all the areas which was very useful for everyone in this current scenario. Uh, uh, so. For all the respected speakers, I would I would thanks to all the respected our Professor Pandey sir, Dr. Ashwini sir, and Dr. Bornali ma'am for giving your valuable suggestions, valuable findings with us. मैं इसे करने से पहले एक बात बोलना चाहता हूँ कि इन सिचुएशंस में दैट इज वेरी इम्पोर्टेंट दैट कौन कहता है आसमां में छेद नहीं हो सकता, एक पत्थर तो तबीयत से उछालो यारो. So if we all are with us, then we can fight with this situation. And after that, with this, I would like to request Dr. Mr. Ravi sir for the giving the vote of the thanks to over to the Ravi sir.
Ravi sir, please unmute your mic.
Ravi sir voice is there is some problem with the Ravi sir voice.
Dr. Prashant?
Yes sir, actually I think there is some problem with Ravi sir voice.
Yeah, I think that the good suggestion is this, that Ravi Prashant will try his best, possibly the audio is not clear, so you can wrap the session with both of us from your side. That will be a good idea.
Yes.
Thank you.
Yes sir. Thank you so much. I think Ravi sir voice is not coming properly. On the behalf of Indian Society of Professional Social Work and Department of Psychiatry, Kalpana Chawla Government Medical College, I'm very thankful to all of you, to our respected speaker, to our participant who has actively participated in national webinar. I think sir voice is not coming and he's trying. So thank you to all of you for attending the webinar. Sorry for it. Sir, your voice is not coming properly. Please. Sorry for many interruptions of voice. And Ravi sir is trying hardly, but I think.
Dr. Prashant?
Yes, sir. Actually, sir is trying.
That, I got it. Dr. Jha is trying his best, but because in between his voice is popping up, and along with that, there is a lot of background sound. So I think that you need to wrap up the session. Thank you.
So thank you to all of you. Sir, Ravi sir, please, I am giving the vote of the thanks. Please, sir. Your voice is not coming properly, sir. Ravi sir, your voice is not coming properly. Thank you so much. I think Ravi sir is trying hard, but he is not connecting. And on the behalf of ISPSW Department of Psychiatry, Kalpana Chawla Government Medical College, I first congratulate to all of you for attending this webinar. And I must say thanks to our respected speaker and to all the participants who has actively participated in this webinar, and might be it will be fruitful to all of you. And as our speaker has as our speaker has suggested the techniques and the strategies that will be helpful for all of you. So with this, I want to wind up the session and thank you all of you.
Thank you.
Thank you, sir. Thank you so much.